Welcome to Effective Cannabis Conversations, the show where knowledge meets curiosity and stigma takes a back seat, where we uncover the transformative potential of cannabis in health. Before we dive in, just a quick reminder, the information we're sharing today is for health awareness only. It is not medical advice or a substitute for consulting your doctor. It is here to help you learn, ask the right questions, and make informed decisions about your health and your care. Welcome to another Effective Cannabis Conversation. I'm Debi Wimberley, and today I'm joined by a true trailblazer in global medical cannabis care, Dr. Gallow. Dr. Gallow is the medical director of the Holistic Integrated Healing Institute and the principal investigator for the first medical cannabis study in Africa. She's a neuroscientist with multiple advanced degrees, a published author, an international speaker, and a powerful voice in advancing cannabinoid research worldwide. Today, we're diving into her research on the endocannabinoid system and why she believes it is past time for the ECS to be taught in medical schools everywhere. Dr. Gallow, welcome. Before we dive in, I would love if you could just share a little bit about yourself and your mission for your work.
Great. Thank you so much, Debbie. It's awesome to be here. I'm a cannabis clinician as well. I also do acupuncture, as a Chinese medicine practitioner. So I'm trying to look at more holistic ways of healing patients. You know, my background was actually in the pharmaceutical industry. I worked in clinical trials in the vaccine industry actually for many years. And then I looked at how can we actually, heal patients instead of just putting a plaster over and looking at root causes of diseases. And that's when I went down the rabbit hole of medical cannabis and cannabinoids. So it is my passion. My vision is to transform global healing by empowering the world with my holistic practices, using science, medicine, and the patient's feedback, which is important. Most of the time, the doctors don't even ask the patient about how their treatment is, what do they actually want. And I think that's the missing part in treating patients. So I'm bringing the whole thing holistically, science, medicine, healing, and that is where I'm looking. And it's been a fantastic journey for the last decade.
Beautiful. Do you treat patients just in certain areas, or can you treat patients globally?
With medical cannabis, I would refer to one of our doctors or clinicians or physicians in that specific area. But normally, if the patients want me involved, then I would normally sit into that consult. But I would normally consult and then make sure they have legal source of cannabis in whichever country. So I have a lot of patients coming here, actually spending some time to get treated by me physically in South Africa. So it's basically a global patient base that I have.
That's wonderful. Understanding that every country is handling cannabis a little bit differently and it's not the same. So you have a really good idea of how each country is kind of handling by the way that you travel around the world, because you've been hopping around the world speaking on a pretty regular basis now. And I think it's absolutely beautiful. Let's dive in.
Thanks so much.
So your research reveals that the endocannabinoid system has actually been essentially invisible in medical education for over 30 years, basically ever since it was discovered. And what was your aha moment when you realized this massive gap existed?
Great. I would just like to acknowledge the other author, which is Dr. Stefan Broselid from Sweden, because he's also worked a lot on this paper and we're able to get it published between the two of us. So to answer your interesting question, I think the first crack in the wall for me came from my patients as well as the students. I train a lot of doctors and that's where it came from. Clinicians were seeing great clinical responses with cannabinoid-based medicines. But then when I asked, where did you learn about the endocannabinoid system? The answer was almost, oh, no, we didn't. It wasn't taught in medical school. I've just read some of your stuff or watched your videos. And that didn't make sense for a system that clearly regulated pain, mood, appetite, sleep, and immune function. So the real aha moments came when I formally checked. I went looking into the standard physiology Bible with Gateson and Hall, and which has faithfully added every major system since the 1970s. And the ECS simply was not there. And then even in the 2020 edition, despite being discovered in the early 1990s, Stefan and I, we ran the bibliometric analysis. And, what he found was how extensive ECH literature actually was. And the contrast between the rich science and the zero curriculum was, basically blaring you in the face. And I think that stopped being a hunch and became a big documented educational failure. So that's how the whole thing went about. And, also when he contacted me, he said, let's do this paper. You're training doctors. Let's dive deeper and look, what is going on. And that is when we are able to put this together and get the paper published.
And I think it's really interesting that you said we've been updating these different systems, but we're leaving this one out. And one of the things I often say is, what if we hadn't have learned about the cardiovascular system or the respiratory system until 1988, and we still weren't educating it? Where would we be?
Exactly.
Wouldn't people be outraged by that?
Yeah, exactly. But I think now, Debbie, what is happening, what I've noticed after training doctors all over the world, they want to know more. They either, as I said, they contact me for training all over the world or watch videos because the patients know more than them. So the patient's sitting in front of them, telling them all about this, and they're like, oh my God, I don't know anything about this. So I think it's coming from bottom up, where the patients are now, demanding, hey, you as the doctor, why aren't you researching? Why aren't you reading articles? Why aren't you seeing what's happening in medicine, the latest advancement? So that has been that change. And I think that's what's been the driving force. That's what I've seen all over the world.
And I understand how hard it is to gather all this information. I've been studying this system for 10 years now, going on 11. What would you say to a doctor that is looking at this and saying there's a lot of education that needs to happen and I need to understand this system? What would be your recommendation to them and or to a patient to engage their doctor with this?
I think the first thing is, the doctors need to learn about the system, learn about the endocannabinoid system. They need to read papers, look at the feedback they are getting from the patients. If the patient says, hey, I've taken this oil, somebody's given this to me, all of my pain is gone, my anxiety is much better, I'm sleeping better, I'm waking up happier, I'm not zonked, with the sleeping meds. I think that's important. That's important that we start to listen. So, my advice is also with the recreational side, or that's also caused a lot of issues in the medical cannabis industry. What I mean there is dispensaries selling high doses of THC. We've seen that happening here, crazy things like 100 milligrams of THC. And then the patient's ending up in hospital. Then that doctor in emergency unit is like, hey, look at how bad cannabis is. Then they give me a call. I'm like, look, this is somebody chasing the recreational side. This medical patient shouldn't be going to that source of getting it from an unregulated source or somewhere where it's more, getting the high. And the reason they are doing that is because there are not enough clinicians or physicians educated about cannabis. So they're desperate. They feel, let me go that route. So my advice is, I'm only talking medical. I stand for the medical. I do agree that the recreational side has benefits, but people are gone crazy. We've never seen these high THC, these HHC, all these crazy synthetic things coming up. And I think it has caused a lot of issues in the industries for medical doctors. So in the doctor's defense, that is what they are also seeing. And then now we need to explain to doctors about dosing. And once they go into the intricacies of the endocannabinoid system, the dosing, the different cannabinoids, the terpenes, how it works, like I can have a patient sleep on 2 milligrams of THC, full spectrum. And now we're going with these dispensaries, selling high amounts of THC, overfiring on those cannabinoid receptors. So I think it's important that doctors need to understand the difference, understand where the medical fits in, understand patients are desperate. That is why they're going to this dispensaries and they don't understand. So that person at the dispensary wants to just sell whatever they can sell, okay, you need pain, let me think the highest THC, and that then damages or, that patient. So, we need to find the balance, Debbie. And I think that is, when let's just go back to medical doctors. They're comfortable with the pharmaceutical system, although it's an indoctrinated system, because they understand how to dose. they know, okay, if I give this amount, this is, where it's dangerous, this is where we need to. So that is what's missing with cannabis. And my training is I make it easy for doctors. So I'm not telling that doctors sit there in your room where you are busy with patients and titrate. We're also trying to, I've got a lot of products also that we are exporting now where we're trying to make the products easier for the doctors to dose. So it's not there sitting calculating and titrating and getting confused, because now they're like a bit scared. Like, oh God, now this patient is admitted in hospital. How am I going to prescribe it? Look at the effect. So I think we need to find the balance. And that is why we wrote the paper about education, because that is key. The moment they are comfortable understanding the receptors, how they fire, how they work, the intricacies, and then the dosing, the drug interactions, then they will feel comfortable. And every time I train doctors after the training session, but with everything, I feel happy to then prescribe or speak about cannabis, to their patients.
In the US, we have actually certified cannabis coaches and educators who go through the same training and pretty much sit side by side with doctors and pharmacists and scientists to learn, because that's what I did. I used to be a medical technologist and worked in oncology, but was disabled for decades and had to figure out how to use cannabis on my own, because there wasn't someone like you 10 years ago willing to help me, or anybody that was a coach or an educator. And looking for information, doing a search on the internet is not the safest place for us to be learning about how to manage our health. I entered a dispensary for the first time. Well, I didn't walk in. I rolled in a wheelchair on oxygen, and I'm asking someone behind the counter, how can you help me control my pain? And next thing I know, I'm rolling out with $500 worth of products. They don't know anything about my health conditions. They don't know about my pharmaceuticals that I'm on, which I was on 28 pharmaceuticals at the time. My life was deteriorating so fast that I needed a 24-hour caregiver. So, these conversations are really important, that we understand for patients that have serious health conditions, how important it is to have that right person guiding them through this. Luckily, my medical training helped me, but not everyone has that. We need to have a huge resource of access to people that can help. If doctors don't want to learn, we would like for them to partner with the individuals that have become certified and are qualified to help assist you in this, so that you don't have to spend all the time, because it really is important. Thank you very much for the work that you do
100%.
and all the education that you provide, because I think it's really critical. When you discovered that the ECS research has a higher H index than the digestive, the endocrine, and the respiratory system combined, what went through your mind, and how is it possible that something so significant gets ignored?
So when we looked at this, we saw there were about 1,000 ECS related publications. I think it was an H index, I think about 138 or something, which was, as you mentioned, which was higher than all of the digestive, endocrine, respiratory actually combined. And then my first reaction was, oh my God, is this is this true? Is it? I first had complete disbelief, and then I got very concerned. So we're not talking about a fringe topic. An H index that high means, the ECS papers, they are being cited repeatedly, and they're also basically shaping, your mainstream biomedical science. So how is it still ignored? And to answer that, it's basically stigma. Anything that's linked to cannabis is treated with suspicion, partially inertia, curricula, textbooks change slowly. And once something is basically left out, there is no automatic mechanism to correct it. So the other thing we have is a silo problem. Cannabinoid research often lives in, neuropharmacology or pain journals. So its systemic importance doesn't get translated, systematic importance, doesn't get translated into the core physiology and teaching. And that is what we've seen. So, bringing it together, a wholesome, I just want to give you an example. I'm trying to publish some papers now as well. One of it is, we're going to talk about it, I know, in the next session about prostate cancer research. And I tried to put this into oncology journals, Debbie. And funny enough, most of the journals have been, rejecting it, which is very interesting, because it is a topic about oncology. And the reason for rejection is it's not a suitable journal. But this is about cancer and cannabis, and we compared chemo as well. So that is, that is the kind of response we are getting. So I think it's also a lot of us having difficulty in trying to publish in specific journals so we can have a whole physiology. As I said, it's in silos, but at least it is there. And if you look at what we found in the paper we published, it is a high H index, and we need to take that into consideration.
So this is difficult to approach and get these articles published. So is there anything that we can do to help make that change and assist you?
Look, I think, I was at different conferences now, and I've met so many academics, which was great, in universities. So what we're trying to do is trying to pool our resources to try to help each other to get things published. So I think that is the great thing, is we need to work together. Look, the thing is, I'm not given up. One did get published, thank goodness, in the Science Direct. The others now, I had to go through Medical Cannabis and Cannabinoid Journal. It's under review, and we're busy fixing up a few things. So I think it's perseverance, not to give up, is my advice to everybody trying to publish. The difficulty with my research is I'm using it physically on patients. When you're doing something on cell lines or animals, it gets approved quicker when you publishing. When you're doing it on actual human beings, which is my research, then it becomes frowned upon, also because of the stigma attached. So, in these conferences, that is why I'm all over the world. I'm invited to present everywhere, because I'm meeting this group of like-minded individuals, clinicians, scientists, academics. We have to work together, Debbie, to get our stuff published out there. And that's what we've been doing. So it's been good.
I think it's really important that you say that you're doing your studies on individuals, because no one's ECS is the same. And so for me, like learning how to manage my lung health and to manage my chronic pain, I have different health issues along that than anybody else that has a chronic pain or a lung issue. And so understanding my ECS and really getting to know it is really important in understanding how this works. I believe there are similarities, but I believe there are differences. Because of the way the ECS works. It's a gene-driven system. And so understanding that is really important. We should be doing more individual studies with people. And I think that we can learn a lot from the people that have already been using cannabis on a long-term basis. And that's why we're starting a survey to collect that information. Just understanding what pharmaceuticals people are able to reduce or eliminate is a key into how the system works. And so I think that all becomes very critical. I applaud you 100% for sticking with doing it with individuals. And I hope everybody that listens to this understands the importance of that. So thank you.
Yeah, and I think we also, the real world evidence, we need to look at that, because that's important. Also, as you mentioned, also endocannabinoids are produced on demand. So today I may be having a good day. I may be less pain. So when I take the dose, I may feel great. Tomorrow I may take the exact same dose, but I'm having a shitty day or something's happening and I'm feeling different. So you're 100% correct. And I see that with all the patients. So the real world evidence for me is key. Yes, we need to do clinical trials, and, we need to put them in a way where, to show the credibility. But I think we must never, exclude the relevance of real world data.
Thank you. Yes, I agree. For the newsletter, we try to back it up with real individuals that are accomplishing what the research is saying. So we're trying to bring the two together to show, okay, this is the research, this is what we know, and then this is someone that's actually been able to put it into play and actually improve their quality of life. And that's the goal of everything that we're trying to do for people, is improve their individual quality of life. I'm not saying that cannabis heals anything. We just learn how to engage our ECS and maintain and control what our system is doing. Would you agree with that?
100%. Yeah.
Thank you. You identified 14 specific coincidences of this educational gap. Which one keeps you up at night? And what's the most dangerous outcome for patients?
It's an interesting question. So the one that worries me the most, I'm going to say worry, but luckily cannabis helps me worry less, is the suboptimal or harmful treatment decisions that have been made. What I mean by that is when clinicians don't understand the ECS, they may dismiss the cannabinoid options entirely, or conversely, patients may self-medicate, as you mentioned, without guidance, like what happened to you. And both can be very dangerous, and I've seen this. So our paper lists 14 consequences, including improper use, lack of monitoring, I think it was diagnostic gaps, inequity in access and delayed adoption of potentially helpful therapies. So what actually keeps me awake is this. People with chronic pain, cancer-related symptoms, severe anxiety, they might be cycling through the opioid sedatives or more invasive interventions, while there could actually be a potentially safer adjunct or alternative that is just underused simply because the underlying physiology has not been taught. And that's not just an academic problem. This is a human problem. It's a human one. And I think every human being has the right to, to choose what type of medicine they want, to understand, okay, this is harmful, this is not harmful, this is what makes me feel good. And I think that for me is the main problem.
I would have to agree with you 100% on that. I think that we should all have the right to choose what medicine works for us. And this is where I want doctors to be curious when we walk in and talk about what we're using and why cannabis is working for us. I don't want them to shut us down. I just want them to listen and be curious. And maybe then that will open the door for them to learn more. You mentioned that pharmaceutical research may be overlooking promising treatment avenues. Can you provide us with an example of what breakthroughs we might be missing due to this knowledge gap?
Okay, I'll just talk about the ones that we're under exploring in several areas where we're missing, basically chronic pain and opioid sparing. The reason I'm talking about this, I ran a huge clinical trial in South Africa where we had 302 patients, where we looked at, can we replace opioids with medical cannabis for chronic pain? How can we do it? How do we wean them off? And for me, there's emerging evidence that cannabinoids can reduce opioid requirements in patients. We've seen that in our research, which is under a review currently. And without solid ECS education, Debbie, these combinations aren't systematically or safely explored. So once the doctor understands the opioid sparing effect, how we can use both together, how cannabinoids actually make opioids work better so we can reduce, and that's how we are able to reduce it in a safer manner, then they're going to learn so much more. So that for me is not being explored enough. The other one is neuropsychiatric conditions. I think I mentioned that earlier. The ECS is intimately involved in mood regulation. I mean, we've seen that stress response in memory. And what this opens up, and we see with veterans also in the US, Debbie, the possibilities for PTSD, anxiety disorders, and even as an adjunct treatments in depression. But again, it's only going to work if clinicians understand which system are they targeting and how are they working together. And the last one is metabolic and inflammatory diseases. I mean, we see this very often with lots of patients all over the world. And as we know, the endocannabinoid system signaling, it influences your appetite, your metabolism, your immune function. And when we're ignoring the system, it may mean basically we're overlooking novel approaches in obesity, in the metabolic syndrome, autoimmune or inflammatory conditions. So the pharmaceutical research follows educational and regulatory priorities. And if the ECS, isn't seen as a core physiology, and I know this is the third time I'm saying this, it is less likely to receive the focused, large-scale therapeutic development that it actually deserves. And that is the missing link.
And I can 100% sit here and tell you that the ECS plays a very critical role in managing chronic pain. I was at 240 milligrams a day of OxyContin. And when I just ask everybody to sit with that for a minute, because that's an astronomical number. Because I live with complex regional pain syndrome. And that's where my doctors took me. I didn't ask for that because they kept trying to get my pain down below a 10. They never could. And so when I was abandoned by them during the opioid crisis, I was left to figure this out on my own. And that's when I did turn to cannabis. And I can sit here now and tell you I'm at a pain level of 0, and I do no opioids at all.
Wow.
Very hard, but it was worth every minute. This is the reason that I started doing what I do, is because when I was fighting for my life and I couldn't breathe for myself, and once I was able to be conscious again, I said, I will do everything in my power to make sure no one finds themselves here again.
Wow, well done, Debbie. Yeah. You've done great.
Then when we talk about PTSD, you can't go through what I've gone through and not have PTSD. Everything you've talked about in those 3 things, we need to be addressing those all together. They all play a role. So thank you again for the work that you do. Your call to action includes curriculum, reform, and textbook updates. If you could wave a magic wand which I love to do, and change one thing tomorrow to fix the problem, what would it be?
Yo, only one thing is how many things I would love to do with the magic wand. If I had one wish, I think it would be to make the ECS a required, examinable part of core physiology in every medical and health science curriculum. The moment you tie something, Debbie, to exams, accreditation, everything else follows, right? The textbooks become updated, lectures are written, we have CPD, continuing professional developments. Clinicians then begin to feel responsible for understanding it. Leaving it as an optional extra or an elective topic, it's never going to correct a 30-year omission. So that will be my wish. And I don't know if I'll still be living for it to come true, because I think we still got a long way to go. I know the SEC, we had a meeting with the AMA, and one of the things were like, when will this be in medical schools? And interestingly, the answer was, maybe in 10 years, maybe if we're lucky in 10 years, if we can start looking at it now and not just doing electives, but looking, as I said, taking that responsibility, I think it'll be great. And that is what I would wish for.
I wish for that just as much as you do. I think that it should actually be taught in all of our biology and science classes in school. Mm-hmm. I learned I had a cardiovascular system and a respiratory system. I didn't learn I had an ECS. Even through my medical training, I did not learn that because we didn't even know it existed at the time. It's really important that we just don't keep ignoring this because of stigma. And if we just all need to remember the reason we're all here is because of the patient. This was all created for medical use to begin with. And we seem to have forgotten that. And I think it's really important that we update the education. I want my grandkids to understand they have an ECS from the very beginning and how that plays in their life. And if we can teach them how to manage their health better than what we do today.
Yeah, definitely.
For patients listening who realize their doctors are not on board and understand the ECS, and in that it regulates their pain, their mood, their sleep, and immune function, what questions should they be asking, and how can they advocate for themselves?
Yeah, that's an interesting question. So for patients who realize their clinicians may not know the system well, I'd suggest a very calm and collaborative approach. Don't, go into like trying to challenge them. Ask questions like, are you familiar with the endocannabinoid system and how it relates to pain, mood, or sleep regulation? This is what I have found by playing around with certain cannabis medicines or doses. The other question is, you can ask the doctor, would you be open to looking at some recent review articles on the ECS and medical cannabis so we can make an informed decision on my healing together? Another one is, if you're not comfortable prescribing medical cannabis, can you rather refer me to someone or a clinic that has specific training in that area? So patients can also ask about, what monitoring plan will they be in place if they're using medical cannabis? How will we track the benefits? What are the side effects? These are the pharmaceutical meds I'm on, like you were on 28. What are the drug interactions? How will that work? And that shifts the conversation from I want cannabis to I want evidence-based care that acknowledges this physiological system. And that I feel is the root. So just to give you some examples, Debbie, like here, especially in South Africa, firstly, a couple of years ago, cannabis, and when I was doing this, a lot of oncologists in the area were like, frowned upon what I'm doing. And can you believe it now? They actually refer patients to me. And because they're like, I don't want to be involved in this. I don't understand it. Here's Dr. Gallow. She knows what she's doing. Go to her. And that is the change I'm seeing, which is very positive. And then we even have meetings where we discuss the patients together. So I see that change happening. And then there are some doctors like, hey, I want to learn more about cannabis. Can you sit in this consult with me? And I want to see how you consult. So it is changing. And that is the positives that I want to mention that I have seen, either being referred to me or working with. And the patients need to also, as I said, maybe use these questions that I've put down and then try and have a more conversation, evidence-based, about your healing with your doctor.
And I think it's really important to take that information in, provide them with, walk in with a piece of paper or a piece of research. One of the things we say with everybody that contributes content to the newsletter or tells a personal story and we highlight it is, take it in with that issue and say, can you read this article, this piece of content? It's produced by, say, Dr. Gallow, and see what this has, and it relates to my health condition. And can you read it? And then let's have a conversation at the next appointment, and maybe not even approach it so technical at that point, but then just bring them in, because I believe we need partners in our health, not just doctors to give us a prescription and us walk out and not really have a good conversation. I think that's one of the things that's been missing in our practice of health.
And I see that, as I said, it is slowly changing. So it's a good thing.
If medical schools started teaching the ECS tomorrow, how long would it take to see fundamental change in patient care? And what would the first improvements patients would notice?
So how fast would care change? So I think some changes may be surprisingly quick, maybe within 2 to 3 years, because if we look at it now, the system, new graduates would enter practice already seeing the ECS as normal physiology, not as a controversial add-on. And then they'll be better at explaining the mechanisms of the pain, sleep, mood, immune regulation in a more integrated way. Also recognizing when the ECS target therapies might be appropriate or when they're also not a good idea, because in certain circumstances, you're not going to use cannabis. So it cannot be, it's not like can be used for everything. So I think that's what they'll be able to recognize. And having informed, non-stigmatizing conversations with patients who ask about cannabis. So maybe over 5 to 10 years, we'd expect to see more structured clinical guidelines. And we've seen a big shift across the globe with better monitoring, fewer myths, more nuanced treatment options. The first improvements patients would notice are simple, but I think it's going to be profound. And then we want the doctors who would stop saying we don't know anything about cannabis. And I want them to start saying, hey, here's what we know, here's what we don't know, and here is how we're going to safely explore or avoid this option together. So it's about this conversation. I want to just give you an example. One of our patients came in and getting great results. We've been doing acupuncture also on the patient, and we've added medical cannabis. Interestingly, I don't know if you know this, but this is a whole nother topic. The acupuncture actually stimulates the endocannabinoid system. So when we do acupuncture and we have the patient actually taking the medicines, the results are phenomenal. I've never seen anything like it. But anyway, I digress. So I was talking about this patient, and the patient comes back after 3 treatments, feeling great, looking great. And the patient tells me they had to go to see their psychiatrist. And the psychiatrist tells them, oh, if they continue with my treatment, they're going to end up bipolar. Maybe they're feeling great now, but that great feeling they're starting to get bipolar. I mean, that is the rubbish that the psychiatrist is telling the patient, having no clue about the endocannabinoid system, what they are talking. So that patient becomes panicky. So then I said, let me call the psychiatrist to explain. And funny enough, we now actually were running a trial with the patients that is actually bipolar to see how the changes are, which is very interesting. So I think it also takes other clinicians like myself that are pro-cannabis to pick up the phone or speak to these doctors that are giving these patients feedback and say, you don't know what you're talking about. Why are you giving this incorrect information? Because you may have learned something bad or read something about this, and this is the information you're giving. And then we're slowly changing that narrative. So I think that is what I want to hear doctors say. Here's what we know. Here's what we don't know. Let's explore this together. And that is where we'll say improvements in patients' care.
It's important that we understand that the ECS plays a role in your health, whether you're using cannabinoid therapies or not. It is important. And you can affect and change the ECS without using cannabinoids. It's a choice of what you're using cannabinoids for that you get to make. You were talking about adult use and recreational earlier. They need to understand they're impacting a system that you're born with, and that wouldn't you want to do it to the best to what your body needs versus just getting the highest THC. These are conversations that, if first and foremost, we just need to teach about the ECS And then we can add in the cannabinoid therapies. This has been such a lovely conversation, and I hope that a lot of people walk away with some new ways to talk about this and approach their doctors. And I hope this opens up for some doctors to be more inquisitive and curious about this system. Is there anything that I didn't ask you about the research that you would like to bring out or share, or anything else that you would like to share today?
Thank you. I think we've covered everything. So yeah, we were lucky enough that the paper, did get published. I think that is where we want to be. Even if we looked at the number of citations I spoke about, the other thing that kind of irritates me, I think in the analysis we looked at 76,000 citations, or 76,843 citations for ECS related work, but we always told the opposite. There's not enough research. So in a field that's maturing, being tested, debated, refined, and used as a foundation for new studies, I think when the patient is told, sorry, we don't know enough about this, what's often true is your doctor hasn't been taught enough about this. That's the crucial distinction. Like I mentioned, the psychiatrist that I spoke to you about. So it doesn't mean every cannabis product is safe or appropriate. It's far from it. But it does mean, Debbie, that patients deserve conversations grounded in the actual evidence base, not in some outdated assumptions or curricular blind spots. And that's what I feel is important. I'm very neutral when I talk about cannabis, because yes, I see people abusing cannabis. Funny enough, I have parents contacting me with kids in university, and I'm treating the patients, the kids, I call them kids, but maybe they're 19, 20, cannabis use disorder with cannabis. So we're trying to get them off smoking joints and high THC, and we put them on CBD to calm them and help them through their studies. And imagine you're treating cannabis use disorder with cannabis, and the parents are contacting you. Like, it's crazy. You know what I mean? So other doctors will say, what the hell are you doing? Are you, so it's the information. And that is why I feel it's important. I'm tired of us saying there's not enough research. We said over 76,000 citations, so we need to start changing the narrative about how we speak about it. And also, a lot of advocates that are for cannabis, then they say cannabis can cure this, it can do that, and then they go overboard. And that's when they also talk about nonsense without clinical evidence. A lot of these advocates that are for cannabis, and don't get me wrong, it does have its benefits, but Debbie, there are certain patients that I wouldn't use cannabis on as well. So when you consult with the patient and take your time with the patient, then you have to find what's best fit for that patient. And what's important to understand, cannabis will not work for every single patient, but it will work for majority, and it's individualized treatments, as we mentioned earlier, what works for that patient. So, for example, some patients, as I mentioned earlier, we can get to sleep on 2 milligrams of THC. Somebody with multiple sclerosis and extensive pain, they can take 20 milligrams of THC full spectrum, and they don't get high, and they're able to function. Whereas someone taking 5 milligrams THC can get high. So it's a very different system. The endocannabinoids are produced in demand. They are biphasic. It's important that we understand all of this and how it works. If you give someone a low dose, they may not have an effect. You give them a high dose, they have a total opposite effect. So it's important that we use the knowledge that we have, and we treat each patient as an individual. And that is why I go back to the real world data and all the real world studies that we are doing. That is really, really imperative. And that's when we learn more about it. And I know we're going to talk or have another session about the prostate cancer, and there's very interesting things that we picked up there, but I'll leave that conversation for the next podcast. But that's going to be interesting, and what even I didn't know that I've discovered, during the research, which was great. And the opioid one, there's certain things I'm like, oh my God, what's happening? And then we went back and we started looking at the notes, and this is what's happened. So that will be exciting. I would leave the viewers excited for the next podcast on the research topics. But yeah, thank you so much. It's been an absolute pleasure. And let's just pray our magic wands are going to work, and we can get cannabis into medical schools and schools. Yeah, as you mentioned, even starting it from biology. So that's great. But awesome, Debbie, and thanks so much.
Thank you very much. I really appreciate you being here, and I cannot wait till we have more conversations about your research and get it out there, because I think it's so needed, and I love highlighting it. So thank you very much for that. We so appreciate you dropping in. Your time and support are invaluable as we strive to educate and advocate for the transformative potential of medical cannabis. Remember, you have only one health and one life, and no one lives them but you. Let's continue this journey together. Subscribe and hit the bell icon to stay updated on our latest conversations. Your comments and engagement fuel the dialogue we need to create change. Until next time, stay empowered and keep exploring the wonders of your endocannabinoid system.